call the July 1st Human Services Committee meeting to order. We'll start the meeting with courtesy of the floor. Is there anyone present who would like to address the Human Services Committee at this time? Seeing no one, we'll close that. And the next item is report from Gracedale. However, Jen was on vacation, and I like in-depth reports. She was unable, just got back right now. I'm not going to get into, we have the director here, so I'll wait till next month when she's been here and we can get into things if we want to in greater detail. So if you have a question, I think we're going to have to save it for the director. I'm sure she's up to date on most of the issues. All right, next we're going to go to the report from the Area Agency on Aging. And I believe, did you want to come up with her, Sue, or do you just, okay. All right, well, if you just want to come up and please introduce yourself and titles, we have it.
Hi, I'm Laurie Greco. I'm the director of the Area Agency on Aging. I'll start with giving unit updates. So our protective services unit in quarter 3 of this past fiscal year, we took 375 RONs. This quarter, we have taken 470, so the numbers are increasing quickly. Staff are back to doing investigations in the field again. They're using screening tools and personal protective equipment as appropriate, and they're also providing it to the older adults and the individuals in the community that they're seeing. Our senior centers are planning to reopen July 6th. All of them will open at this time except Hispanic Center. That target date will be July 12th. The Saucon Valley Center, which will likely be sometime in September because they have a school-age program, so they don't want to bring our seniors back in when they still have school-age children in there. And the Nazareth Center is pending bathroom renovations, so they want to wait until those renovations are completed, and then they'll open back up again. We will be opening up using social distancing and health and safety mitigation efforts. We've sent out letters to the participants so everyone is aware, and they will be signing a letter, which they would have returned by now, acknowledging those mitigation efforts and their willingness to follow them. When they do reopen, we're going to restart our health and wellness programs in a safe social distance manner. That includes our chronic disease self-management program, Walk with Ease, and our arthritis exercise program. Our 21-22 Health and Wellness Annual Plan has been approved by PDA, and I want to say that PDA commented on the Health and Wellness Plan that was submitted by Kim Nickel, our Senior Center Director, saying that her submitted plan is perhaps one of the best organized and thorough submitted plans I have ever received, and as always, your attention to detail is outstanding. So I did want to mention that. Kim's doing a great job. Our senior centers distributed goodie bags during our closure, and this was also done with our care managers for our options program. So through our drive-through events and delivery, we gave over 1,300 goodie bags out, and these included some activities, some snacks, some hygiene products, things that maybe would help people feel like they're getting a little gift being stuck at home. And this program does continue. We still have bags left over, and when staff are going out to see individuals in the community, they're taking them. We've given out food bags that include fresh and shelf-stable foods, both through drive-through programs and delivery, and we've given out over 700 of those. We have a tablet lending library that we purchased for our senior center participants to keep them engaged through technology, and these are equipped with Wi-Fi so that they can get on Zoom calls with their families or connect that way and their friends, and also for our health and wellness programs that they can do online. So far, we've only lent out about 9 of those, but we're hoping to get more people once the centers reopen and we can do some training and the participants are more comfortable using them. Our options program, which provides the in-home services in the community, we currently have 531 consumers enrolled for services, and there is no wait list for services at this time, so everyone who needs services is receiving services. Our assessment unit is projected to complete more than 350 assessments in the 4th quarter. We received $237.12 per assessment. This is unretained earnings and it's unrestricted, so we can spend it on what we need to. So pretty much last year, we earned enough money to provide full care plans for 23 older adults for 1 year. So it does provide funding for services for folks. Our caregiver program continues to grow. We have more grandparents in the program. We currently have 5 grandparents, which doesn't sound like a lot, but we had 0, so we're growing. We currently have 40 caregivers enrolled. That doesn't include the grandparents. And our caregiver program has also been doing virtual caregiver support groups via Zoom while we were not going out into the community. Our PRIZE program, which has been rebranded the PA MEDI, which stands for Pennsylvania Medicare Education and Decision Insight, that helps people with Medicare enrollment. We currently have 7 volunteers that assist with that program, and we're training another one. So that program is growing as well, and that definitely benefits seniors in the community. Overall, our agency has done a lot for vaccines. We had over 60 homebound seniors scheduled in cooperation with the neighborhood health centers of the Lehigh Valley, that they were scheduled by us to get them set up for their vaccines. Almost 600 older adults were telephone registered for the Wind Creek clinics in cooperation with the Bethlehem Health Bureau. And our supervisory staff assisted in person in registering folks at the Wind Creek clinics. And I couldn't even give you a number because we were just registering people that were walking in. So it was a lot of people. 100 vaccine appointments were scheduled for a clinic that was held at the Hispanic Center through Capital Blue Cross. Our staff assisted at 2 vaccine clinics that were held at Oliver Border House. And at those clinics, we also distributed the goodie bags and some fresh food items in partnership with the Kellen Foundation. We have funded Lanta rides for vaccine appointments for 114 seniors, and that program is still ongoing. And for our Meals on Wheels consumers, 120 Meals on Wheels consumers received their in-home vaccines, and that was through a partnership with Meals on Wheels and the Bethlehem Health Bureau. For the CARES and FFCRA money that we had received, we continue to utilize those funds, and we have spent that money on senior center supplies to prepare for safe reopenings, PPE for staff, for our consumers, for our providers as well. We've assisted them to make sure they have what they need to do in the homes. Community outreach, such as the goodie bags and the food bags, internet connectivity for older adults, and the tablets that we purchased for the lending library. We were able to clear our wait list and provide services to everyone who needs it, and we continue to.
Can I just pause? Sorry. May I ask a question? Can I pause you right there? Because a question came up when we talked about broadband funding, and somebody raised the issue about seniors. Do you see that as a need? That are there people who are underserved, or seniors that are underserved or have poor access to the internet? Because as you're training them, or is that not an issue that we need to consider?
No, that's definitely an issue, and that's something that we're looking to support them with if that's a need to help them stay connected, definitely.
So I guess there's is there any data, or are there any numbers that you could give us so that could be included when we consider that as part of the funding?
We had funded that. I don't know, Sue, if you remember the numbers on that. I could get that to you, because we did do a program specifically for that. And then also our tablets are all equipped for the seniors as well.
Okay, thank you. Sorry to interrupt you.
That's okay.
Okay, why don't you go ahead and continue with your report?
Sure, I just have one other thing I wanted to say, that with the CARES FFCRA funding that we received, through April, over 71,000 home-delivered meals were provided. And that includes our regular options consumers as well as seniors who were affected by the senior center closures and social isolation.
Is that your report?
That's it.
Questions?
Yes,
Ms. Zirinsky?
unless you have. So it's my understanding that the Oliver C. Border House is run by Lehigh County, or owned by Lehigh County, and then run and managed by some other entity?
So many years ago,
Lamont?
yes.
She's-
Yeah, Lori, stay, you're not done yet.
Yeah, you're not.
So many years ago, when Ron Engel was here, he used to love to talk about how he didn't vote for something, right? Remember that? Yeah. I didn't vote for that. He was the only one who didn't vote for that. Well, during Mr. Stofa's administration, it was proposed that the Northampton County Housing Authority be subsumed into the Lehigh County Housing Authority, and the Lehigh County Housing Authority would manage the Northampton County properties. It's my view this is not working out. It hasn't been a secret that it's my view that it's not working out. We are currently working with the Department of Housing and Urban Development to rectify this situation. By the way, I voted against it, and I was the only one that voted against it. That was my point of telling you the angle
So
story.
you're currently working with HUD.
We currently are. We have to have sufficient capacity to, once again, have our own housing authority. And that may include working with another housing authority, maybe the housing authority of the city of Easton. All this is to be determined. But I wanted to give you the history and the context of, and so housing authorities, as you know, they're independent authorities. They're independent of the county, but the counties historically appoint their boards.
Right.
So that's how counties are involved with the housing authorities.
So,
You have any other questions for me? Or
yeah,
do you-
so
Go.
what's the relationship then with the Area Agency on Aging with Oliver C. Border House and the senior center that's kind of adjacent to it, right?
That would be Lori's.
Okay.
Well, as far as our vaccine effort for that, we were just helping the seniors, and they were kind of bringing in other seniors. The center-specific question, I would have to get back to.
But are there any other, like, responsibilities? Like, if a resident had a need, they would call you, right? They wouldn't call someone in Lehigh County, and certainly they wouldn't call the property manager that is at the Oliver C. Border House, right?
It would depend what their needs are, because sometimes the property managers are who contacts us if there's
Oh,
an
they
issue.
contact them.
They could be. I mean, we get referral sources.
Okay,
if
because it's
any-
my understanding that they have a board at their little Oliver C. Border House too. And that they had a liaison from, well, not a liaison, but one of the residents was a board member on that. Right? But is that still meeting?
I don't know.
Okay,
I don't
because
know that.
after talking to some residents at that Oliver C. Border House, they indicated that the senior center was not going to be able to open. They did not say that it was because of the renovations of bathroom services. They were under the impression that it was like, might have been a certain punishment by the management, that maybe they weren't going to open that senior center because they didn't have the capacity to run it, or they didn't want it open because it would be extra work.
I haven't heard anything about
Is there
that. I know
a way to communicate to residents
Sure.
at the Oliver C. Border House the reason why their senior center is not going to open July 6th is because of these bathroom renovations? And I think that they would have better understanding. And so it's also do you intervene with the property manager to make sure that the residents have what they need?
We address issues as they come up. I can definitely discuss that with the senior center director to see what kind of engagement there is for that. Absolutely.
I would really appreciate that.
Sure.
And I will share the notes that I took from my conversation, and maybe we can come to some resolutions there, because I know that there were a number of residents who were concerned about certain things that were happening there, and I want to make sure that they're taken care of, because many of them are very vulnerable, either because of intellectual capacity or physical capacity, illness,
Sure.
and they don't necessarily have advocates there for them. So I think it's really important.
Absolutely. Okay.
Thank you.
Yeah, Lori, let me ask you, just dovetail on that. I mean, we have a very close, or we did, I mean, despite what Mr. McClure said, that's one issue, but overall with human services over the years, the actual functioning services and what we do and what they do with aging, for example, because of our unique situation, for example, with the city of Bethlehem and the overlap, that we've always tried to, on your level in terms of services, have pretty decent communications with our counterparts. Is that still something that happens?
Cross-county, you mean?
Yes.
Absolutely.
Yeah, so in other words, I mean, it's not like something would, if there's an issue and we have somebody, or there's a house where there's people from both counties, generally you're going to find out if there's a real, they'll let you know if there's an issue, just like you certainly would let them know if it's something they may be aware of. I know we always fostered that, and I'd like to believe that that's always been going on. I mean, there's always been issues where certainly at a director's level or a legislative or executive level, that maybe there's been a difference of a policy or opinion. But on the staffing level, we've usually had pretty good cross-current communications. And I just wondered, that's
Oh, absolutely. We have very good relationships.
particularly in
with
aging. I always
with our
found in
neighbors.
aging that the other areas, sometimes there's a little I call it intercollegiate competition at times, or intramural. But at the aging, I always found both aging departments really were on the same page over the years. Now, maybe that changes at time. I'm sure there's always going to be a little hiccup here and there, but
Yeah, no, we work very well together. We communicate very regularly. I communicate with the director of, Lehigh County and Monroe County included very, very regularly. And our supervisors, it's a very tight network. The aging network is very tight, and we have regular meetings and regular communication. So we all actually know each other very well on a first-name basis.
so would it be your judgment that if something harmful, and this isn't going to happen all the time, or something that potentially could be a problem, the way the system is set up now, generally speaking, you would probably be made aware of it if it had something to do with a Northampton County resident?
Absolutely.
All right, I just wanted to make sure.
But that's not this situation, though. This situation is Oliver Border House is where it is, as you know. It's not in Lehigh County
No,
with
it's
Northampton County residents. It's in our geographic center, and it's managed by Lehigh County's housing authority.
Right.
We don't have a housing authority that could liaise with them because council chose to subsume our authority too. And so the complaints I generally get through the state representative's office. When it was Marcia Hahn, I got it from Representative Hahn. Now we get them from Representative Flood. So that's where they go to seek the redress of their grievances. And we have to tell them, well, we gave you away years ago. But, we do have board members. Becky Bartlett is a board member, as a matter of fact. She carries their complaints to the board and makes them clear. But it's not the sort of same one-to-one type of relationship that Lori would have with her counterpart in Lehigh County.
Okay.
These are
But I mean,
distinct, these are
hold on.
distinct issues, and there's really, and the sense I get without having been physically present or read notes, when our complaints, meaning our residents' complaints, are brought to the management of this authority that we have been subsumed under, it's just the way it is.
Yeah.
All right, so, but
That's the answer.
but you are hearing, I mean, I guess what I want to know
It's
is,
to the point I'm fighting to get it back for us.
I understand, but from her perspective, the service perspective, I mean, I'm just concerned, you are getting, it's going, what Mr. McClure's talking about is going to the state, and the people feel frustrated, they're not getting through the authority, it's saying, and, that's a very common, we're trying, whatever, things happen. But, I mean, as far as what we're trying to do for the people, you still have communication with our people, even though Lehigh County Authority is in charge of the building.
Yes.
And so you're chronicling all of these issues. If there's an issue, for example, even though we can't address it directly, let's say it's an authority issue, we're still keeping track of those concerns, aren't we?
Well,
So that we have something, as Mr. McClure said, if in fact something changes down the road, we have some solid reasons as to why we think there's a good reason we would have to do that. And I don't want to put you on the spot.
I'm not really clear
I mean,
what kind of large-scale issues, yeah.
I mean, I
deal with,
guess
like,
my
the
concern
people
is,
issues.
you don't feel like, in your sense, the job you have in terms of protection of the seniors, right now, you're comfortable with that.
Yes.
But there are other issues which I realize aren't on your plate, they're on our other people's plates. So I guess my fundamental thing is, when I think of the senior services, you're okay, and your counterparts in Lehigh County, I'm putting the authority off on the side on that. In that sense, you're you're working together and you're fine.
Yes, absolutely.
And you're made aware. Okay, great. And that's all. I was just curious in this conversation because I know it comes up at times, particularly in Bethlehem over the years, where the political lines of counties are almost invisible at times in human services particularly. And that is very hard to understand but I mean, what Mr. McClure is talking about, I get, and I'm thinking of that over with this part of the brain right now. But this part I'm asking about services. So thank you. You clarified that. I was just concerned. Oh, you want to follow up?
I just wanted to follow up.
All right.
So my other question is, what kind of services would our county then be able to offer to people who are residents there who might need some assistance? I mean, it's not assisted living, right?
Correct.
But there are some elderly individuals there who might need to be checked in on, or to make sure that they're eating enough, or that they're mentally stable, or that they're taking all their medications. I mean, when I noticed when I was there walking through, I mean, there were parts of it that very much resembled a nursing home. Do you know what I mean? Not in that the care, but that the people needed a little bit more assistance.
But it's not assisted.
It's not assisted living. So I guess my question is, what liability do we have for the people living there who might need more assistance in allowing them to live there? Not that we don't want them to live there. We can't discriminate like that at all, but like to make sure that they're safe.
When we put in services for individuals, we need to make sure that it's a safe plan. We're not going to put in something that's not going to keep them safe and then just kind of walk away and check in on them every 3 months. If that wouldn't be enough for them, then we would explore other options of higher level of services. There's waiver programs, for example, for people who do have a higher level of care, but they want to remain in their home, in the community, to give them more intensive levels of services and provide more than what we can offer through our options program that we do through the Area Agency on Aging.
And would they have to request that? Because some people, I feel like, reach a capacity where they might not notice that they're slipping or their faculties are slipping.
Yeah, I mean, our agency is a good place to start because if one of our care managers goes out, they would assess the individual and they would determine at that time which program would best suit them.
But they would have to be referred. I mean,
Yes.
Maybe you should explain, Lori, how information comes to us that potentially gets investigated.
If I could, Tara, and I think that's a good idea because these are people just the same as people who live in their homes or in an apartment or the bath places. And I mean, and this, what Tara's saying could affect anybody at any time. So maybe you just want to give if you could, a brief, Tara, if that'll help, a brief update, which might be helpful for everybody. A brief update of, for example, somebody's outside the system. How do you get referrals?
Sure, and our referrals can come from anywhere. They can come from the building managers. They can come from you, if you're seeing them. Family members, postal workers, paper
so I could-
delivery people can call our office. There's a program, the Gatekeeper program, is kind of an anonymous referral program that they would call and make a report. And it can be very general, that they have a neighbor and they're worried about her because her garbage has been accumulating, or she's outside and it's 10 degrees out and she's wearing shorts and a t-shirt. Would you go in and look in on her? And that's when we would go out and check and see what's going on. If it's a very high level of a concern of an abuse and neglect, whether it be caregiver neglect or self-neglect, we would send our protective services unit out there. That would be a higher, more intensive, high-risk kind of intervention. But if at any time there's any kind of concern, anyone can call our office and request to make a referral, and we follow up on all of them.
and that's important. And I think that would be empowering to the people at the Aldersea Border House to know that they could do that, because I think sometimes they have concerns for the other residents there. Like, they're a real tight-knit community in terms of looking out for each other because of their circumstances.
Sure.
They're so close.
Sure.
And, I think knowing that for them, that they could have somebody to go to would be really important, so.
Sure, and they can call us if they have a concern, about one of their neighbors.
So
Sometimes
just
those are the best referrals that we
Yeah,
get.
So just whatever's on the website, they just use that information, call, and then, okay, that's important. Because sometimes people wouldn't call in themselves, but they need help and they just don't
Yeah, and we
realize
don't
how much
need,
help
we
they
just
need.
need to know where to find the individual.
Sure.
Sometimes there's not even a name associated with the referral, just kind of where they live and go
Oh,
check them out. Yeah, so you don't
proximity.
have to know their birthday or any of those vital demographics, just where we can locate the person.
That's important. Okay, I really appreciate that. Thank you so much.
Anybody else? Mr. Kusick.
Yeah, thank you. I appreciate the work you do. I guess my question has to do with money. As you know, the federal government has unleashed a fire hose of money upon us. Is there anything that you need that could be paid for out of the federal money that?
We continue to look with the funding that we're receiving as we're going, especially now that we're reopening our senior centers and getting back out in the community. So that's kind of a changing situation. So I really don't have a specific list at this time. We're
Well, you
growing
should
with it as we go. Well, because we've been growing, we've
Yeah.
been expanding, we've been doing improvements on our senior centers, improving our programming, getting things to benefit our seniors. So as we discover a need, we're looking into how we can meet that need because we do have the funding
Yeah,
at this
because
time.
if you need money, now is the time to ask.
Absolutely, absolutely.
Another suggestion I would have for council, we have executive directors from Lanta, the Planning Commission, the Airport Authority. Why don't we just invite the executive director from the Oliver Border House to a future committee meeting to do a presentation? Thank you.
No
I think
problem.
that would be
Sounds,
to the council, probably.
Well, council or to one of our, I believe this would be the appropriate committee.
yeah, I would say either this committee or council as a whole. I mean, I'll do it at this committee if that's, the wish. And I don't have a problem doing it. We could do it in the future. I mean,
I would just hope that everybody would be here.
yeah, I mean, I mean, given some of the things we heard, it might be helpful for it to be at a meeting where all council members are present, but I'll talk to Ms. Vargo Hefner and, Ms. Wondolowski, and we'll come up with a game plan. How's that? And I'm sure as what happens as far as this fire hose of water, or of money, I mean, you do, as most division heads do in fact think of many things you could do depending on budgets, and that goes right up to your boss, right?
Correct.
So I have a feeling that she's probably the one who's received various wish list items. I don't know, I'm not going to put you on the spot and have you or have you not, but that would be how you would say, hey, you know what, we have this program, but boy, this would be great, or that would be great. And that would
And
go
we've been fortunate
right
with
to
the
her.
funding we're receiving, we don't really have to drop a wish list. Because of the
That's great.
fire hose of funds, we're able to meet the needs of our seniors at this time, so.
Good. Okay, we're always glad to
Last,
hear
but we're
that.
able to do that right now.
When you're
Are you finished, Mr. Kusick? All right, Ms. Vargo Hefner.
I just want to say that I think about where you started, under a pile of papers, and where you are, to be able to say, well, we have a lot of money, but you have the money because you cleaned up that department so nicely, and your staff has done all this good work, and to hear the kind of comment that was made, it's such a testament to your leadership and all the good work that you've done and all your staff has done. So thank you for everything that you do for these folks.
Thank you.
I'm an old person now. He told me today I can receive your services. We're a tough breed, so keep up the good work.
Thank you.
Are there any other questions for Lori? Yes, let me just, just on that, you're doing a great job. I remember there were times when aging, because of funding from the state, didn't get the money they needed. And we would be trying to figure out how to get services out there and how to expand and how to connect. You probably still have a pretty good relationship with Meals on Wheels, because that was always a great source of what Ms. Zirinsky was talking about. There's different organizations. Meals on Wheels was one where it could be somebody who really isn't in the county system. They're in Meals on Wheels, but somebody will notice something. They'll go into the home. It hasn't been clean. There's small, strong scents. And they'll just call up and say, hey, you may want to, boom, 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 or just to make you aware. And also then you come down, though, to the one of the hard facts, which is depending on when people are slipping or sliding, Ms. Vargo Hefner just was speaking glowingly about old people, but sometimes they can be stubborn too. And you can't force somebody unless you know, if you feel it's bad enough, you could certainly, and I know you do, you go through the court system and guardian, but that's an involved process. But I know your folks are usually pretty good at persuading people that maybe they could use a little help, or the honey, I know the honey approach is used a great deal in aging, and that's always a good thing. So anyway, if there's no other questions, Lori, thank you for coming up and explaining these things, and we appreciate it.
Thank you.
Thank you very much. All right. Next, we have a report from the Director of Human Services, and if possible, I'd say let her, if you want to break in, and if she goes through different things, let her go through the thing, and then we can break in with a question, or, you know, I don't know how you're going to give your report. I assume you're going to go by divisions and whatnot.
I will. I actually wanted to,
Yeah, go ahead. You're up.
okay. So,
Ms. Wondolowski.
thank you. I asked Lori to stick around. I read all of these comments to her yesterday, but I had a phone call with Anne Marie Pinella, who is the Aging Advisory Board President. And she knows that some of our advisory board can be, they have high expectations of Lori and our aging department, which is great for our seniors. But Anne Marie Pinella called me to let me know how fantastic she thinks Lori is. So since it was just yesterday and Lori's here, I figured I would share them with you because, as you know, we don't often get the nice comments. So Anne Marie, for anybody who knows her, was very vigorous in her descriptions and said that Lori is doing a great job. She has a mountain to climb, and she is doing it, and she has the skill level to make it even better. Anne Marie said Lori has a big job to do, and Lori is the person for the job, and she has full confidence in Lori Greco. It's always nice to hear those things about her folks, so I just wanted to share that with you. So you don't have to hang around anymore, but but thank you. I actually would like to start, if it's I told her to. Mr. Heckman, if you would be okay with it, Robin Barbosa has spent the last few months working on bringing in a trainer from Louisiana to help us create the first loss team in Northampton County. And you might not know what that is, but I was hoping that you would allow Robin a few minutes to explain that because it's a pretty big deal. So.
Sure. Why don't you come on up, Robin? Give your
Thank you.
name for the clerk and your title, and go ahead and start.
Robin Barbosa, Deputy Director of Human Services. So Northampton County and the Northampton County Suicide Prevention Task Force had the wonderful opportunity of hosting Dr. Frank Campbell at our DHS building the last 2 days to train several individuals to be part of the first ever Northampton County LOSS team. We love our acronyms. LOSS stands for Local Outreach to Suicide Survivors. And I should say, when I talk about survivor, a suicide survivor or a survivor of suicide is one of the family and friends of someone who has died by a suicide. So for example, if I had somebody in my family who died by a suicide, I would be a survivor. Dr. Campbell created this model in 1998 in Baton Rouge, Louisiana, where he lives, when he identified that it was taking lost survivors an average of more than 4 years before they reached out for support. So we were very excited to have him come to the county to conduct this training for our staff. He will be coming back to Pennsylvania again in September in Harrisburg, but if we would have had to wait, we would have, but we didn't want to wait. Northampton County wanted to bring him here sooner, and we were very thankful that he was able to come here sooner. So a LOSS team is made up of trained survivors and others who are called out to assist individuals who have lost somebody to suicide, to not only disseminate information to the family or those who are at the scene about resources, but most importantly to offer hope and to be a support for that family. They're really there to listen. They're not there to provide any clinical support. It's just really there to listen, let them cry, let them scream, again, continue to offer that support. The procedure would be that once a suicide death occurs, either the coroner's office or law enforcement would contact the loss team, and we would gather our loss team members to the scene of the suicide as soon as possible. They have to be in teams of 2, and one of those individuals has to be a survivor. And the hope is that it would almost mirror the suicide death that occurred. So for example, if there was a child who died by suicide, that survivor and member of that loss team would be saying to the individual, I also had a child who died by suicide. So just so that they could see that someone else has kind of been through the same experience that they have. The visit is very family-driven. The team may get there and the family might not be ready to talk about it. They may be very angry. They might not even want to see anybody, and that's okay. We would leave our information with the family member or even a neighbor, and then the team would follow up with the family in about maybe like 2 days later. On the other hand, there may be instances where a family may want to be with you with the whole time, especially while law enforcement is there and the coroner's office is there, continuing to conduct the death investigation. I know Frank, Dr. Campbell said the one time he was with a family for over 5 hours. So it's just really family-driven because, again, that you're just being there for their support. And then sometimes he'll say, like, more family will come in, maybe like a few minutes later or like an hour later. So you're almost there for the entire family. We know that the scenes will be predictable and they will occur at any time. So the team knows that they could be called out at midnight, even during the workday, so they understand that. We had 18 individuals at our training the last 2 days. We also had the pleasure of having our coroner, Mr. Lysak, attend the 2-day training, and he provided a wealth of knowledge to the team. He answered any questions that our team had, especially in regards to specifics of how Northampton County does things. And then on the second day of our training, we had a detective and a lieutenant from the Bethlehem Police Department provide information on crime scene etiquette. The loss team cannot interfere with the investigation, so they were just trying to say, when we come to a scene, where should we be directed to? Obviously, there will hopefully be law enforcement there and the coroner's office still there, kind of like guiding the team to where the family will be. We received phenomenal feedback over the last 2 days from the participants in the training over the last 2 days. Dr. Campbell is truly passionate in the work that he does. If you Google him, you'll see that he's been in documentaries, he's been on the Discovery Channel, other media outlets. He did notify us that there's actually a new documentary coming out. It's called My Ascension. I actually looked it up yesterday and it actually looks very interesting. It's about a 16-year-old varsity cheerleader named Emma who attempted suicide but survived, but due to the nature of her attempt, she is paralyzed. And so the documentary focuses on not only her desire to walk again, but her passion to bring school-based prevention services to Louisiana. The documentary also highlights the stories of 2 other young individuals who tragically did not survive their attempts, and it interviews the families on how the devastating effects of suicide are. So we still have a lot of planning to do. We really wanted to get this training by Dr. Campbell done first before we figure out our next steps. So we know we have a lot of planning with not only the coroner's office, but law enforcement. And as Sue said, there's no established loss teams in Pennsylvania, so Northampton County really hopes to be that first one, and Dr. Campbell knows that, and he said he'd be a support to us along the way during our planning process, so we're really eager to start this endeavor.
Thank you very much.
Sure.
Are there any questions for Robin? Ms. Bargo.
Can you give us some other updates on the task force and some of the other work that they're doing? This is great, and it's definitely, a needed thing, but can you tell us a little bit more about what the rest of the...
I will try as best as I can.
You could do quick. I don't mean to tell
That's
us
okay.
everything.
We actually
Just
just,
quick.
at our last meeting, we kind of just did, so the task force has 3 subcommittees. We have an education subcommittee, we have a community subcommittee, and then we have an aftercare subcommittee. So each of those committees have their own separate goals. I know the education one is really focusing on how do we bring more education services into the school districts. We've talked about possibly making new badges for students with the suicide hotline numbers on. But I know maybe some schools can't do new badges, so we're trying to figure out ways to maybe have cards for the students so that they'll have the information on there. So we're trying to figure out better ways to promote more suicide prevention and education in the schools. And also bringing, I think I talked last or one of the past meetings about QPR, question, persuade, and refer training, bringing that to the school districts as well. Our community subgroup, we are continuing to focus on our first responder peer-to-peer support group. So we're still working on that. We are working, the Lost Teams training was one of our goals, so we brought that here, so that's check one off that list. We are also looking at planning events for September for Suicide Prevention and Awareness Month. Sue might have a little bit more information about this, but we're hosting an Iron Pigs Night. We're co-hosting an Iron Pigs Night on September 1st, where we'll have, I think right now there's about possibly 15 tables of organizations that will be there to pass out information. There'll be messaging, so there'll be events there throughout the rest of that night. And then our aftercare committee is really working about providing resources. So they're almost working hand in hand too with the Lost Team. So they're focusing on identifying what resources we can give to the families after a suicide death occurs, or even for those who have attempted and survived their attempts. So providing information such as support groups, where can they turn to for mental health services, depression screenings, the crisis hotline. Tiffany Crush, who's our mental health administrator, she spearheads that committee, and they put together a wonderful, almost like a folder with information, tons of information on it that will be given to families when the Lost Teams goes out, because there's other things that they found out that many families might know about, such as if a suicide death occurred in your home, you need to contact your insurance company. And these are things that families might not remember right away or have, have at the time. So it's good that they'll have these things to reference. So each of the subcommittees have goals that they've been working on, and they meet monthly. And then we report our goals to Sue and how we're doing on those.
Are you aware of are there support groups in the county? Are there active support groups, or
There
it's
are
unlimited, or?
There are active support groups, and then I know even for a fact we had one of our he is a survivor, and he also is on our Lost Teams. He also does some of the support, he runs some of the support groups. So I know we talked about that yesterday, and there are other ones in the community too that I can get you that information if you'd like.
Yeah, do you have providers on each of these? Or are they mostly volunteers and community members on each of the task forces?
A lot of them are with organizations already, and then they kind of are a lot of the educational ones are on the education subcommittee. I feel like the community one is the biggest one, and I spearhead that one with some other individuals. So we have people from St. Luke's on there, the Bradbury Center. They're from all over. Mm-hmm.
Thank you.
Yep.
Are there any other questions, excuse me, for Robin? I know, and I've had the occasion to people I know who, their parents or spouses or siblings pass away, and we think sometimes, we're aware of things, but not everybody's aware. So I would say, for example, I don't know how many times I've made people aware of grief counselors, people specifically. And I think sometimes we take for granted that, well, yeah, people know. But I know, I brought that up to a few people I know, had no idea that there was such a thing. They thought, well, you want me to go to a shrink?
Right.
I don't know. It's specifically because different people handle it differently. And some of us don't even realize that we really could use some of that. It's not, to maybe even have shortened the time period. But I would assume part of this then would be informative.
Yes.
If they notice something, to let someone know.
Yes.
Like this isn't like heavy duty, but it's let them know. And if they feel, well, gee, I didn't realize that, then, they would follow up or help them if they would want it.
Correct, yes. So the Lost Team will follow up with the family then, yep. Mm-hmm.
Okay, thank you. Thank you,
Sure,
Robin.
yes.
If there's no other questions, I'm going to let Robin go, and she can relax, and we'll have Ms. Wondolowski back up here.
Everybody loves presenting at council. So since I'm giving compliments out today, I have to give some for Robin. Frank Campbell, who she spoke about, has got to be one of the nicest human beings I think I've ever met. And actually, that would also go for Robin. And I introduced myself to Frank the first day, and he could not go on and on enough about how fantastic Robin was and how accommodating she was and helpful. And I said, I think everybody likes Robin. And he said, if there's anybody who doesn't like Robin, they probably should be checked out. So anyway, thank you. So Robin has worked tirelessly for months. As she said, Dr. Campbell's coming to PA in September. And I said, that's not soon enough. We want to be the first loss team. So I greatly appreciate all the efforts that Robin has made over the last couple months coordinating that. It was a very large undertaking, but one that will be well worth it. I don't know if Robin mentioned it when I stepped out real quick, but the loss team, when they go out, obviously these can be they will be very emotional scenes. And so we are going to make sure that we have debriefing sessions for our folks as well, because they'll definitely need it. We had sort of a similar type situation a couple weeks ago, and our crisis folks got called out to a home, and we made sure that we regularly were checking in with them throughout that day and the next day, and then during the rest of the week, because it was a really hard scene. So these folks do impossible work, and they do it well, and I appreciate that. In terms of the Iron Pigs that Robin mentioned, so that will be the big event that we're doing for Suicide Prevention Month. We'll also host another event where we honor folks in the community in Northampton County who do a lot of work in suicide prevention or who assisted with somebody in particular to prevent a suicide. So I know a press release was hot off the press maybe just yesterday calling for nominations. So that will presumably be out there, and I know Becky will put it, actually I think Becky already had it on Facebook because I shared it. So if you all know of anyone who you would like to nominate, check out the Facebook page, and please feel free to share that widely. So we're going to try to collect nominations by around mid-August. I think it's the 20th, but it's sometime around August. It's in the press release. But the Iron Pigs, that was supposed to happen last year in May, and of course it didn't. So it actually works out, I think, really well because September is the month that we really focus on this. So we are co-sponsoring that with AFSP, which is the American Foundation for Suicide Prevention. And their local branch leader is Jim Presto, who has been an active member on our task force since day one. So we are co-sponsoring that. There'll be some video clips on the Jumbotron throughout. Unfortunately, I have to be out at Penn State for a presentation, so Robin might get to throw out the first pitch, but maybe she'll have to do an arm wrestle with Mr. McClure over that. But Robin will Robin will pinch hit for me in terms of, yes, I'm sure she did. So anyway, we're really excited about that. So Robin has been involved in those planning meetings now as well. So any questions about that before I go on to the rest of my list?
Yes. What do you have, I forgot to ask, an intended launch date for the team? Because it seems like it's really moving, so.
I don't know that we have a date, but Robin and I have to get together, if not tomorrow, then as soon as we get back next week. It really is now just about coordinating all of the policies and procedures, if you will, creating a schedule, because if we have, I think was there about 20 folks? How many, 18? 18 folks at the training. And so, we'll have to develop some sort of, schedule, if you will, of, a rotation so that folks aren't always, the same people aren't being called out or always having to be by their phones. So we really just have to work those out. So I would certainly tell you that if Dr. Campbell's coming back here in September, it will be before then.
And there's no certification for this, right? Because it sounds like a lot like certified peer recovery specialist, certified mental health, so it sounds like it's along that vein, but
Correct. No, there's no.
does Louisiana have a certification for it, or?
No, Frank Campbell created this. He is the only guy in anywhere who is providing this training. I told him he has to clone himself. And so no, it's not a certification in particular. And it really, I think the peer-to-peer support is a good analogy. It really is meant to be just that. It's sort of a supportive role, so. And all of the folks who volunteered, either they have personal experience with this or, they have mental health or human services backgrounds that it's not too far outside the scope of what they normally do.
Any other- Mr. McGee?
So I'm assuming there's a growing number of these survivors that we call survivors, and the statistics that behind that is headed up.
Well, interestingly,
Age groups or,
yeah, I mean, I guess that number probably always goes up, but the total number of suicides went down in Northampton County from 18 to 19, and then again from 19 to 20. I don't have those numbers in front of me. I reported that a couple months ago. A few years ago, we were at 50, 54. 2020, there were 30 suicide deaths, so it was a huge decrease. And one loss is one too many. I'm certainly really worried post-COVID that number is going to climb back up, especially with unemployment and mental health stuff. So
thanks.
to be determined.
If there's no other questions, why don't you go ahead and
Sure.
continue?
So today was the first day for Maria Torres. She is the person who will be taking over for Julie Bader. Julie Bader's last day as the CYF administrator is October the 1st. So we were thrilled to welcome Maria today. Julie reconfigured her office, and there's 2 desks, and so they are sharing an office while we really have the fortunate ability to have Maria get 3 months under her belt with Julie and the CYF folks before officially sort of taking over solo, if you will. Julie's October 1st is her last day. So I met Maria in the morning, and she was still there in the afternoon, so that was a very good sign, and she promised she was coming back tomorrow. We'll see about next week.
Bonus, right?
Listen,
What's,
I don't take anything for granted.
hold on.
It's Maria, and it's Torres, Torres. Yep.
She's been with the agency?
No, she comes from Kids Peace, where she was for 8 years, and then for 12 years before that, she lived in New York and worked in similar roles.
Okay. All right, any questions? Ms. Kusick?
Yeah, since you brought up children, youth, and families,
Sure.
I noticed we're still advertising for caseworker 2s.
Yes.
How is that going? How many vacancies?
I don't have the most recent number for you. I have an old number in my file. The good news is that number has gone down since we last discussed it. We have run into some new, and they're not new. I guess they've reoccurred some issues with civil service and delays, and which is very frustrating. So I think it's going to be an interesting time over the next year. During really all of COVID last year, after the first couple of months, I had commented to Mr. McClure, it was really interesting to see the kind of new hires we were getting in children and youth. And really, because typically it's folks right out of college. And we were getting a lot of individuals, male and female, who have had years of work experience. Some got laid off, some just were making a change or had relocated. So it's going to be interesting to see over the next year or two, because we have had a couple of folks leave the agency altogether. Most of them still are going to the 3rd floor to mental health and aging. They've had some retirements and some turnover. But some people are sort of taking a relook at their lives and, post-COVID, is this what I want to be doing? So we're doubling down on the retention efforts. Kim Kickline, the assistant administrator, that's part of her big focus. And they have come up with some new initiatives and ideas that I think will help. But the number is down, and when we get out of civil service, that number will be down even more.
Ms. Hefner?
Has there been any changes from the state in terms of the documentation or any revisions? Because that's always the stick
Nope.
point.
Nope. It's very frustrating. Streamlining it would be helpful. There's discussions,
So I
but
guess, is there, I don't even know how to ask the question, so I'll just use my other hat. Like, what can we do as an entity? What can your staff do? What can the staff around the state? Because again, we have bureaucrats making these decisions that are not clinical people that don't understand the practice. And everybody at all ends get frustrated, and those workers get caught in the middle. So what do we have to do to support the efforts to get help for these folks? Because I understand from Mr. Cusick's perspective, it's a staffing issue, but it's also a staffing problem because they are
Sure.
overburdened, overworked. They're the pariahs in there. I mean, like, they don't get a lot of go teams from people.
No, and I
They
think
get a lot
I-
of derision. We've
Yep.
had conversations about this week. So what can we do to help support those people emotionally in their jobs, whatever? Because, I mean, I do appreciate what they do, and I appreciate the tough position that they're in, but
you know, it's not an easy question to answer. I think I talked here once about a study that Penn State did that demonstrated 60% of a caseworker's time is spent on paperwork,
right.
which means 40% of less of their time is spent with people doing actual casework. I often suspect that number's probably even higher.
If their paperwork is anything like the training that I had to take for free for the state, which I did,
Yes.
and got stuck in a feedback loop for 45 minutes on the same question, I feel for them deeply.
Yes.
Like, and that's just one snafu among many, I'm sure. I
I
understand, like, if you have 5 kids in the same family, it does not populate to those 5 children. You have to enter all the data for each child, which is absolutely ridiculous. And I guess if you have a mother and a father, you'd have to do it twice, correct?
and that would be if there's only one mother and father involved in that particular family, and
So,
usually have a few.
so whatever you think we can do to help, or whatever we can empower them to do.
I think, you know, some of the strategies we've tried to take are simple things, technology-based. So they have used different voice activation for dictating, which the folks who have used that, it's made a world of difference. We've implemented some new procedural safeguards with supervision and how often it's occurring and how supervisors are monitoring paperwork completion to try to stay better on top of it. There are, it's sort of the rarer person who can somehow manage to be an excellent caseworker and always on time with their paperwork. It just is, and everybody there, look, we have a lot of great people there.
Do you give them blackout time? In the state of New Jersey, they used to give DIFAS workers blackout days where they could just do paperwork and not have to answer calls.
So
do
we-
they get that?
Before I got here, they had implemented library hours, so those, well, it used to be on Wednesday, I think it's still Wednesday from 9 to noon, so it's once a week. That was pretty much the max that folks were willing to agree, because you have to be quiet. And with 130, 40 people on that floor, that's a hard task. So they do that once a week. One of the things within our CPS unit that we have started is we have some new workers who have finished their training and are now able to take cases as they come in. And so we are affording each worker who's been there for more than 6 months or a year, they get a skip week every month, if you will. So they get a week where they get no new cases assigned, and they only are doing paperwork or casework on current cases to try to catch up. And I am told, that's only started maybe 3 or 4 weeks ago, and I'm told that for some of those folks, that was incredibly helpful. It doesn't solve the whole problem. So they're really, I give them a lot of credit. Supervisors are open to ideas from casework staff, and they're trying to implement different things like that to increase retention and avoid burnout, because it's been exceptionally challenging not post-COVID, but post the crisis of COVID.
And when they're on these library hours or whatever, is that communicated to the consumers? Because again, a consumer will then flip that script to say, no one's calling me. When, again, those folks used to make it very clear to me that they were going to be unavailable at a certain time. So is that communicated?
I don't necessarily know that we communicate that to everybody, but folks leave voicemails or emails, and then those get returned. And if folks hear of people who are not getting their calls returned, let me know. I'll always follow up and make sure that someone has called back. I've talked to a few of you about that over the last couple of years.
Yeah, it's just, again, a matter of protection for the workers, because sometimes there's reasons you can't, whether it's volume or you're otherwise engaged, so.
They're usually trying to put out the biggest fire. And, you know, my goal has always been from day one to get to be at a different place, but it's not easy.
Thank you.
Any more on,
That was it for CYF.
okay.
The Intersect Alliance folks have
I'm
continued.
sorry, what was that?
Intersect Alliance, it's called. Guillermo Lopez is our main contact there for some of you who know him. They're the ones who have been doing the work with law enforcement. So I wanted to just give you an update as of a week or so ago of what the numbers were of number of law enforcement officers who have gone through that training and where they're from. So Bethlehem Township had 15 participants. The city of Bethlehem has had 18. Colonial Regional has had 12. Nazareth had 9. Lower Saucon had 12. And Palmer Township had 12. Oh, and the Northampton County Sheriff's Department had 100% of their staff, sheriff deputies, go through the training. I don't know what that total number is, but they all have completed that. I know that someone had asked, Mr. Myers, I think, had asked about a syllabus or objectives, so I thought I have that now, and I just thought I would share it briefly. I know he's not here, but it'll be in the minutes maybe. So there were 4 session objectives. I'll just go through those quickly. Develop a framework to enhance cultural competence practice within and across Northampton County's departments of law enforcement. Number 2, create an environment of awareness of self and others, as well as the ability to navigate diverse perspectives in the organization. 3, learn how to proactively and reactively manage conflict more effectively by providing.
I mean, slow then, like, so that I think people are writing, so just see.
They need to learn shorthand like Georgine.
I think that's going
I
to
can-
be quite a task.
I
Can you
can,
just give us
oh yeah, I probably can just give you
printout of
this,
that
yes.
then? Yeah.
Highlight it and give it to them.
I'll highlight it and
Thank
give it to you.
But you go ahead and keep talking. then.
I'm almost finished. To proactively and reactively manage conflict more effectively by providing tools to assist diverse groups as they work together during highly emotionally charged conflicts. And 4, maximize participants' ability to effectively manage work, learn, work on, and build teams, develop people, and build internal and external relationships. So far, that has gone well. We have a meeting on Tuesday, a Zoom meeting with the chiefs of the departments that I referenced. And we're going to talk about what worked well, what didn't work well. And I have an addendum on my desk from Intersect to continue the work for the second half of this year. So we haven't ironed out the details yet, but some of that's going to incorporate some community work now with law enforcement. So we're really excited about that work.
Was that first come, first serve?
Yes, but we had ultimately 20 trainings with 20 max participants, so we could have trained up to 400. One of the challenges I know was providing that large a number of trainings within a 2-month period. There were so many choices for people to choose from, so some sessions, if we actually had 10 sessions, we probably would have had them more full. So we're going to space them out a little bit more, but we're also, Guillermo Lopez has been working with Randy Miller, who is the president of the police chiefs, and the Nazareth police chief, to try to engage some of the police departments who have not yet signed on for participation. So that's our primary focus for the second half of the year, is engage more departments and try to get through as many of the officers as we can, expand to the colleges probably, go from there.
Any questions so far? Then go right ahead.
Okay. State budget, I don't know if you all saw from CCAP, essentially the news for human services is that it's flat funding. So I got that the other day. That was what we were expecting, but that is now confirmed. So it's not great, but it's not as bad as we were expecting it to be.
If I can just a question, because now and then I keep, I don't know why, but this Mr. Cusick's fire hose of money keeps sticking in my head for some reason. But I was watching the news, and the state was talking about, they were fighting, which was interesting, over what they're going to do with all this money. You know, and generally, that's not a fight they have at the state level. And I know they were talking about putting money in their rainy day fund, expanding that. They're certainly going to push more for schools, which is fine. They want to have parity. But in all of this, you know, I guess I'm just somewhat surprised a bit. I mean, you're right. Flat funding in many ways is a win, because I've been there when we've not had flat funding, and that is not a fun thing. So the thing is, I guess I'm just, and I know you have an advocacy group through your group and through CCAP, that human services, which is the massive county responsibility, didn't see any kind of increase in this time when all this money has come through. And I mean, I'm just wondering, were people you associate with shocked? I mean, it's not unusual for what the state did under regular circumstances.
Right.
And you're saying, thank God they didn't cut my budget.
Sure.
But was this something where it's flat, but did you see some spikes, and maybe you were going to get into this, in certain areas at all, and it just averaged out as flat?
There were, I can tell you real quickly.
I mean, I'm really disappointed at the state, and we talked about bureaucracy. It's very disappointing that they were complaining about what to do with all this money and almost fighting with each other. And human services is flat funded. So it blows me away. I don't know what to say.
I think we expected it simply because our folks at the state have kept us in the loop for months, and I think they have been aware that despite advocacy efforts, that's.
And I get your job. Part of your lifestyle, like you're in now, is you really, really wish and hope for the best, but you're expecting what you got.
You've been there, Mr. Heckman. You can understand it. So,
yeah.
Children and youth, or the child welfare, actually got a small increase, but it's not necessarily going to trickle down to us at the county level. It's not like we suddenly have another $1 million to do prevention work. We will get additional funding, but it doesn't trickle in that way. Let me see. Mental health was a nominal increase. Substance abuse was flat. So overall, the overall picture was an average of it being flat. So there was some little adjustments
so you
in
said,
there.
but it was essentially flat. And I don't know, get into a preachy thing, but I think Mr. Cusick can relate to this. Peg was there, she could. Year after year, they always want you to do proactive services. And we all know, if we've been in it, that there are things we could do to ameliorate some of the things that we know are coming. I mean, there are people working in the divisions that know something's going to happen, but they have the data, but they don't have the money. It's like, they have the money. I have the knowledge, but I don't have the money to use it for anything. And we've been, over the years, we were pressed to do more proactive services. And we've preached that to the state decade after decade. And I don't know why, but this really irks me this year to hear you say that. It's sort of like somebody rubs a scratch, and on me, that was a particular scratch that somebody's rubbing. That I mean, they're even saying to us, I feel so for the state would say, you have to do more proactive. It's like, we can barely cover the things we have.
Yep.
We've got all kinds of proactive plans. Give us the money and we'll implement them.
Yes.
So I don't want to drag this out, because knowing me, I could really drag that out. I've had that argument in conversation with numerous people at the state and even Fed level. But I mean, it's just a bit, this year it's a bit surprising to me based on what I've heard coming out of Harrisburg. I'll stop.
I don't
Go ahead.
disagree, Mr. Heckman. I think Mr. Myers had also asked how many bilingual staff we have at the agency. And I have that information, and of the folks that we know are bilingual, we have 28. So that's spread across the divisions, primarily Spanish. There are a few other languages that some folks speak as well. So I just wanted to report that back. We're in the process of finishing up our contracts. So early intervention, Mr. Heckman, they got a 3% rate increase, which was great.
Good.
They told us that after we sent out the contracts. So, like it's, so it's good news. We'll, take some more trees to reissue some things. But, so contracts are being done across divisions. We have a bunch back. I'm sent $1 million to the county executive's office. The time of year, I feel like all I do is sign my name. So, so that's being done.
Every county executive has had made comments once they're in office about human service contracts costs.
Just need stampers, just stamped signatures, that'd be good. Yes, you do. No, I say we need, not, I know you do.
They got that, they need Tommy John surgery at the end of their terms.
He reads them too.
How you know that?
I know that because sometimes he calls and asks me very obscure questions about a particular contract and a particular service and a particular amount. It's true. So I too read the cover page of every contract because I know I'll have to answer questions. But that's where I stop because the rest of it is boilerplate language, so. Yesterday, we had our second community forum with our folks from New Zealand for our decision aid tool. And the first one we had, I think I already spoke about that. That was with folks who are mandated reporters, essentially. So different folks we have throughout the community that we work with. And last night was folks from agencies or in the community that work with, work directly with the families who will be impacted by this tool. So our team, Rima, who spoke here via phone, and her crew, and Emily Putnam-Hornstein, who is at UNC Chapel Hill, they gave an overview of what this all is. We talked about the pitfalls, we talked about why we're doing it, what we want to get out of it, what we hope to accomplish. And the purpose, of course, is to continue being fully transparent about this particular project, since it involves data, and sometimes that's, people want to know and they have legitimate questions. So that was finished last night, so we'll go back through that, and they actually they have software that transcribes the recorded Zoom sessions. We're working on, IT has created a web page for me for just the decision aid tool. So I actually went to upload some things on it today, and I can't recall how to do that, so I need help from IT now. So I'm working on that. And so they have, the folks from New Zealand have put together the first basic model, if you will. And I don't have the data on it yet, but I will tell you I think they're very happy, and it falls right in line with seeming like it's going to be just as accurate as the Allegheny County model. Biggest difference being, if you recall, Allegheny County uses about 80 or 100 different data sources, including criminal justice data, mental health data, drug and alcohol data, and we are only using child welfare data that already exists within our system, and it's still just as accurate. So lots more work to be done, but we're really excited, and I guess as of today, July 1st, we entered year 2 of our contract. So we will keep on keeping on.
Any questions about that? Go ahead, continue.
That is that. Oh no, one more quick thing. I just want to mention. We talked about the Suicide Prevention Task Force, but I had this at the bottom. Alex Carrillo, I think, has been in to talk to you all, the director of our Veterans Affairs, and I'm so happy with how hard he is working and all the things that he has done. And he's also, Alex, well, he was here as an introductory. He might not have come back to do like a presentation yet. Still trying to get his feet under him, but he's on the Suicide Prevention Task Force, and he recently connected with the a woman from Wilkes-Barre, the VA office, whose only job is suicide prevention. And so he invited her to join our task force. And I reached out to him to talk about some of the different initiatives we're going to work on with veterans, in particular for suicide prevention. And he had already coordinated a meeting with some different folks, including the Wilkes-Barre VA, to discuss that very topic. So I'm really pleased and happy to have him as an active member on that task force. So that is all that I had, Mr. Heckman.
Any other questions? Well, we'll start with Ms. Hefner.
The RFP on health choices.
I just got an email today. It is being released this month, I believe, but I don't have the exact date in front of me. Did you get that email? Do you remember? Okay. You think it was this month?
So it hasn't.
Okay.
Hasn't been awarded yet, is that true?
No, it hasn't even been issued. So they just finished the last piece of it. It was a very tedious back and forth. So that will be issued. And then there's, of course, the long process. And I believe it's a bit longer than normal for health choices because of the volume of information that has to be reviewed for it.
Is that it? All right. I thought I saw, Mr. Kusick.
Yeah, a couple things. I know Ms. Stewart King isn't here today, but maybe you know, has the Gracedale Advisory Board been meeting again?
They met last month, I believe. It was either May or June. But they meet, if I'm not mistaken, I heard Jen say they meet next week.
Okay, that's good to hear.
Yep. I don't know that they had a quorum.
Well, I just am glad to hear that they're meeting
Yes.
again. And then the other question I had was, I know she was looking for an assistant director of nursing. Is that position filled yet, or what's going on there?
We had, so we hired a gentleman first, and then we hired a woman, and so we had two. Lorena is the second ADON we hired. I hear fantastic things about her. She is there. The first gentleman, I think, decided that nursing home care was not for him. So that position had gotten reposted. I know that they have had a couple of interviews, but not anybody that they think would actually be a good fit and able to stick around.
Yeah, because, I mean, I saw the salary is potentially up to 6 figures, so certainly it's not a matter of pay.
No, and some of that's the way you're right, because some of it's the way it gets listed, but,
Well, if someone has a certain amount of experience, we have a certain amount of flexibility that we could do, but,
right.
yeah. But
Yes.
still, I mean, in my opinion, the issue there shouldn't be pay. I think that the pay is adequate for the position, so I'm just wondering.
I think the last time I had talked to HR, there were at least a few ADON positions within the local area being advertised.
Yeah. And my last question is, somebody asked me this, do we do any business with Valley Youth House?
We do. We have, we primarily work with them through children and youth. They primarily work with older youth, independent living, runaway youth. So they definitely have some independent living services that we contract with them to do.
Okay, because some questions have arisen recently about them, and I think somebody sent me something that said that their CEO makes like $300,000 a year or some.
I may have just read that as well.
Is that true?
I don't know that for a
I just think
fact.
that's insane, but I mean, what are we getting for our money? That's.
Well, that's, listen, I couldn't agree more in terms of ensuring that we've talked about outcomes, and ensuring that there is value in what we get. I can tell you that historically, they've had a very good reputation, but we don't rest on our laurels.
Yeah, I
So-
just think maybe we should review our relationship with them, given some of the things that have come out lately.
Well,
Understood.
if I may, I think one of the concerns, I know what's come out, and I think most of us probably are aware of what Mr. Kusick was speaking to, and that's unfortunate. As far as pay goes, you could look at some of these nonprofits. I mean, we could be talking to a lot of them about the CEO pay, and that's a whole road I'm not going to go down right now, but I know it frustrates directors of human services because if somebody says this, what you're getting paid, or and they sort of think you should be walking around with a tray with hors d'oeuvres on it, but compared to some of these CEOs and the nonprofits. But I guess that's a discussion for another day. As far as their services go, and this is where I think it gets kind of messy, is that Valley Youth House, and I can speak to this because I've worked with them as both a caseworker and as a director. They provide a really necessary service. I mean, we don't have, I don't know if it's changed, but we really didn't have a lot of resources like that in this area for both counties. And I mean, for the runaways, if it's done right, it's a valuable resource for runaways, and now I think it's more involved with LGBTQ kids and emergency placements, because we'd always have a problem with children where all of a sudden at 2 a.m, we've got to place this child in a safe environment. And I can speak from my own experience. Anytime you get involved in this, there's going to be hiccups. And I'm not going to speak to the current thing because I don't know more than what I read in the newspapers or what I see or out there on blogs. But I mean, I don't know. I think the resource is probably we use, I would think, fairly heavily in children and youth. So does Lehigh County, because I don't know what's out there that could replace them at this time. You know, their reputation has been good. Now I'm not going to speak to what they should or shouldn't pay their CEO, because most nonprofits, you could look at the CEO and then you drop off a cliff to the next level of supervisory people. But anyway, so I mean,
yes.
I would think up to now, as far as the actual care goes, have we had any recent problems with them?
No, knock on wood.
Okay.
We have not, Mr. Heckman. And I think, to your point, you know, the capacity issues are significant. And so, you know, we have X number of agencies, for example, who provide foster care services. Really, if we had to cut any one of those out, it would be a huge loss. Even if they only had, say, you know, 10 of our youth in care, there are not enough services in anywhere. I mean, it's not just the Lehigh Valley, but anywhere
and wanting
that.
to keep local too. There's places
You're
where the
correct.
children,
You're correct.
you know, we could go, and I've had people would say that sometimes in negotiating contracts. They'd say, all right, well, if you don't want to pay our rate, you can send them off to George Jr. here or there. And these guys can be pretty cold. But the thing is, we do need local resources, but I guess we'll just keep an eye on it.
No, listen, I think we always have to monitor our providers, and we do, both fiscally and programmatically, every year. And, you know, if concerns arise, they certainly get addressed. But you're correct, they definitely have a niche service that they're one of the only folks in the area that provides that service, and it's our responsibility to make sure they're doing it well.
So, and I still have good peripheral vision, so Ms. Hefner's been doing a hand wave for a while now, so.
That's really
Ms.
good.
Hefner?
Well, just to join in, I started my career there as an intern, like way back in the dark ages.
Well, that explains it.
Yeah, I'll get you later. And it was a runaway shelter. It was a really small building on 8th Avenue in Bethlehem, and all they did was runaways. And, you know, coming back to the Valley in '02, they had expanded, they had done all kinds of services well beyond that. Therapists, in-home therapists, support services for parents, counseling, the LGBTQ focus. They had school-based counselors in all over the Valley, not just limited to Northampton County. But so I'm not, you know, I'm not supporting his salary or not, but I just think that they did grow and keep up with the times and the service needs as a lot of providers have. And there's other providers who, this is all they did. The CEO was there for 30 years. Some of those folks worked their entire career at the same agency. But you have been very good. And you and I met when I was first on, and the chair of this committee, and you just got your job, and we discussed at the very beginning that one of the concerns we both had was making sure that contracts were reviewed every year, that there were outcomes, that the same providers aren't just getting a pass every year. And I think you've done a good job, and I think we've done a good job sort of vetting through and monitoring in all departments where that has been problematic. So, you know, I think at least at your end, I haven't seen any difficulty with that. And then again, I know, I know that their school-based contracts are not always being renewed. So it's the ebb and flow of this business that, you know, somebody new comes along or the funding gets cut, and so that's his job to go figure it out. Ours is to make sure that our constituents get the care that we've asked for as per the terms of the contract, so.
Correct, and with all of our agencies, there have been some services that we've cut over the last 2 years because they haven't been, and I'm not talking about them in particular, but across different agencies that we've cut because they haven't been providing the outcomes that we need to see, so.
Okay. Are there any other questions for the Director of Human Services as she stands here before us? If not, thank you,
Thank you.
and I will ask for adjournment unless somebody has some pressing issue. Move it to adjourn? So adjourned.
Lori, the RFP is being issued tomorrow.
Oh, really?
Good times.
Fair process.
Do you have an RFP with the county? That should be disclosed. Do you have an RFP?
No.